Welcome to Acute Conversations, the official podcast of APTA Acute Care, where we share engaging conversations about acute care physical therapy so you can connect to your profession. I'm your host, the Arguelles, and in today's episode, our guests are Ashley Parish and Dawn Drumm, who were part of the team that helped create the Pediatric Vital Signs Guide. We discuss how the guide was initiated, the collaboration between the different academies, and the influence of Reggie Miller from the Indiana Pacers has had on one of our guests. Enjoy the show. All right. Welcome to another episode of Acute Conversations. Today, our guests are Ashley Parish and Dawn Drumm. The reason I asked them to come join me today for the podcast is because we have a new Pediatric Vital Signs Guide. Is that correct?
Yes.
Fantastic. Yes. And before we move forward, I also want to give a big shout out to all the other people that contributed. Morgan, Rodolin, part of APTA Acute Care practice committee. Just thank you so much for all the work you did to kind of put this together. And this is just an opportunity for Ashley and Dawn to talk about the Vital Signs Guide for pediatrics and all the work it took to put it together. And also just for people to know that these are the therapists that kind of worked and put this together. Maybe we'll start off with you, Ashley. How did this all come together, this Pediatric Vital Signs project?
Yeah, so back in the day, a couple years ago, way long ago, I was the inaugural education chair for the Academy of Acute Care. And I immediately emailed Tracy Norris when I found out there was an adult version of this coming out. And we have to do a pediatric version. And this is a great opportunity to bring together not only acute care, but cardiopulm and pediatrics into one document and make this just a really robust and strong document that can be used not only in acute care, but really in most settings. So that was kind of how the project started off.
Fantastic. And then Dawn, how did you get roped into this whole big project?
Yeah. So I actually was in academia. This is back in 2022. I had a short stint and I really wanted to get more involved in some committee work and landed on the practice committee, and they had been working on some other projects. And then Morgan and Rodolin had asked me to join in to try to help facilitate getting the document really completed. So I came more on the tail end of things. So Ashley laid a lot of foundational work and I felt like I just was able to help facilitate closing all the loops a little bit more.
That's great. That's great. So maybe a little bit of background of who you are and what you've been doing for the Academy and what you're up to right now. So let me start off with you, Ashley. So before you were involved with, and you still are, but you've also gotten some new roles, correct? Since that and since the beginning of the year, I think you've got some different positions and maybe some different titles. Can you share that with us?
Yeah, so I've always been involved in multiple APTA academies. I'm actually the current president of the Academy of Cardiovascular and Pulmonary PT, which again is a great marriage with acute care. There's a lot of projects that we can do together, but there's a lot of research out there that can be done, just a lot of collaboration between the two academies. I was a respiratory therapist before I went to PT school, so my love has always been in the ICU and specifically in pediatrics. So from a clinical perspective, I do cardiopulm peds, and I work a lot with kiddos who have had heart transplants, have trachs, things like that. More recently, I'm in an academia-based role, but I still practice clinically at a local pediatric hospital as well as at our STEP clinic, which is a transitional clinic from children with complex medical conditions that are transitioning into the adult world. So in a marriage of the best of the both worlds, I'm still in clinic and in academia. At UAB, I'm an associate professor and our director of assessment. So that's a little bit about me. I'll let Dawn share her experience.
And then real quick, UAB is University of Alabama at, is it
Birmingham? Yeah.
Birmingham. Fantastic. And how long have you been there now?
Oh, forever. I literally went to respiratory therapy school here, and then I did my DPT degree here. I did my PhD here. So really, I've been involved with UAB since 2004 when I first came here as a freshman.
Fantastic. Awesome. And Dawn, a little bit about yourself. And just as a caveat, I'm a big fan of Dawn because she's also part of the practice committee and she's also in Chicago. But that's besides the point. I'll let Dawn speak on those points.
Yeah, so I guess my background is actually I started in adult care. I actually worked in burns and trauma. That was my first love. always wanted to merge into pediatrics at some point, but I really felt like I needed a good foundational generalist background, but still in acute care. I've really very minimally worked in outpatient and mostly have focused my time in acute care. So started in burns and trauma and then landed at Lurie Children's back in 2008 when I made the decision to just focus on pediatrics, and currently spend all my time primarily in the NICU. I work with a lot of medically complex infants, a lot of infants with BPD. So that was, I think, one of the things I really enjoyed about this project is bringing that information, because I think it's obviously a very growing population that I think can span the lifespan as well. So I take it from the beginning end, and then a lot of these infants will still have some chronic illness that needs to be dealt with as an adult.
You say BPD?
BPD, yes. So that stands for bronchopulmonary dysplasia. So lung disease. Which we see a lot in our infants born preterm.
Okay.
Very early. Yeah.
And so Ashley, take us back to, so I think you did, is that correct? You did your undergraduate degree in respiratory science or respiratory therapy?
Yep, respiratory therapy. So I still have my license. I'm still a respiratory therapist, but I don't practice clinically.
And so what drew you to acute care? Part of it is just having that experience from your undergrad. And then what was the jump from respiratory therapy into physical therapy? And then while in PT school, transitioning into kind of full-time for the acute care side of things.
Yeah, so I think this is a funny story, but like most people going to PT school, I wanted to do kind of outpatient sports related things. Dawn, I never had an interest in integument at all or burns at all, but I wanted to be a PT for the Indiana Pacers because I'm a huge NBA fan, but I came to realize that I really like the ICU. So I kind of grew up in the ICU as a respiratory therapist with ventilators and things like that. So going through PT school, like my clinic rotations in ICU and trauma and all of that, I just loved it. Like, to me, you have to use critical thinking, clinical judgment. There's a lot of parts and pieces that go into it. And I always tell my students, when I walk into somebody's room in acute care, the first thing I like to do is just scan the room and look at all the medical equipment, because it's a giant puzzle. It's like, how are you going to get this person up? They're hooked to 50 different lines. And to me, that's always a challenge. I feel like my brain's always working in acute care. And I just love that area. I love to see people go from being really sick to walking out of the hospital. There's nothing like that. So I just love ICU and acute care.
And then that's the acute care side of things. And then how did you find your way eventually into pediatrics and acute care?
Yeah, I just really liked peds. I don't know, I guess my personality is very bubbly, but I like working with kiddos. Specifically, I know Dawn mentioned she works with infants, but I love that population because you get to see them accomplish milestones, and it just melts your heart to see a kid roll for the first time or to pull into stand or to take their first steps. It's just really magical.
It's funny, some information about me. So I was also very familiar with the hospital because my mother, she's retired now, but she was a NICU nurse over at Illinois Masonic. And so I remember visiting her, and I do remember kind of peeking in or looking into the window and seeing what she was working with. But it was territory that it was, at least when I went into PT school, that was like, I was used to being in the hospital. So my heart goes out to pediatric physical therapists, especially the ones that work in the NICU, because part of that is all those years of my mom working that helped pay for my tuition from high school and undergrad. And then it wasn't until I was older, and then she was nearing closer to her retirement age, where I actually was I got a chance to go into the unit. And I'm like, wow, she's been here for 30 something years in this same unit. And this is the types of patients and people that she was working with. So again, my heart goes out to the NICU physical therapist. Yeah. And so Dawn, tell me, how did you get involved? First of all, what was your route into PT school? And I also think what's pretty cool between the two of you, there's this Indiana connection, which is really
We do. And actually, my daughter graduates next week from Purdue. So actually, this week, it is a busy week. But yeah, so I really love hearing all of these stories, just like Ashley, how you mentioned how you landed there. I actually got into PT school right out of high school. I was primarily a dancer. I did many years of ballet. And so my background was I was going to be a PT for a dance company. That was always my plan. And then life happens, things change. And I actually went a little bit into speech pathology. And then the light bulb went on a little into studying that actually wasn't really what I want to do. And so it took a longer route to get back into PT, but eventually landed there. And I graduated from Rosalind Franklin in 1997, super dating myself. I am very old. And then, like I said, started practicing in acute care right out of the bat. I actually ended up doing a burn rotation while I was a student. And I will say I was last pick. That was not at all what I wanted.
Wait, let me just say, as a DCE, for all of my students, listen to this story, okay? Because sometimes you end up with not the rotation that you like, now.
It shapes your career.
100%. I was like, this is not at all what I wanted. But I will say I had probably still the CIA had still influences my clinical decision making. I think back of things that we did back in that clinical. And when I left that clinical, I was like, I'm going to find a job in a burn unit.
Wow.
And yeah, I spent 9 years actually doing burn care. I was primarily doing that. And then I worked at, it was Cook County Hospital back then. Now it's name changes, but that place really shaped me. It was a very, like you said, Ashley, the daily clinical decision making and the acuity and the critical illness and just needing to really I felt like I was problem solving every minute of my day in such a healthy way. I left there and I'm like, I did the best I could today. Or sometimes that wasn't the case. And I was like, I need to do better tomorrow. I need to figure this out. And not having a lot of resources being at a county hospital, it was, you had to really think on your feet. I always joke, honestly, we did not have push button canes at the time. So we had to saw the canes for the patients. Yeah. I was like, I'll be right back. I'm going to go saw your cane to adjust for your right. You just did what you had to do. It wasn't like I really thought much about it. Yeah. So then again, had another light bulb moment back in 2006. I was like, it's time for me to change. I really want to focus on pediatrics. I've been doing some of that at Stroger. I definitely been doing about 50-50 split. So half my time in the burn, half the time I was working on our pediatric floors, including the NICU. Everywhere we all floated. And then made the jump to Lurie Children's back, Ann and Robert H. Lurie Children's Hospital back in 2008. And then have been practicing there since and still work there all of my hours. I have a little bit of freedom where I get to do a little bit of research. So I do that kind of outside of that. So that's fun too. Yeah.
So Dawn, when you were first practicing over at County, were you in the old building?
We
or
were.
always at Stroger?
I actually practiced in both. So I've lived through 2 big hospital moves. So
wow.
I went from Cook County to Stroger. So that was a big, interesting move. And for those who don't know, that building, I think, was built in 1865. So it was an old building where, yeah, we definitely had things falling apart there. And then Lurie moved in 2012. So I was in the old building in Lincoln Park, which is a
Fullerton and Lincoln, in that area.
Yeah, cute little part of Chicago. And then we moved downtown to Streeterville. And that was primarily because you generally want to be near a birth hospital. So all of our NICU patients, the parents would be quite separated back in our Lincoln Park. And in Streeterville, it made them a lot easier to visit. Yeah, a lot of stuff, but fun.
That's interesting, Dawn, is that you had mentioned working at County, and then you had also mentioned that you you graduated from Rosalind Franklin. So shout out to Donna Fraunfelter, because I feel that she had a lot of work over at County. I think that's where she started. And I think if my memory serves me correctly, she started as an inhalation therapist.
Yep. And we actually, when I started there, we were still doing, Ashley, you'll be happy to hear, we were still doing like the manual postural drainage, vibration and percussion. I'm not going to lie. I think one of my first pediatric patients, they were like, go for it. And I was like, I don't know what I'm doing. Stay nearby. So yeah, everything was safe. We figured things out. It was all good. But yeah, it definitely was a place that had to think on our feet pretty quickly.
Yeah. Ashley, do you have any favorite stories or favorite memories or good memories from back when you were working as a clinician full time, especially with whether it's in the pediatric realm or just in the acute care in general?
Just seeing my patients accomplish milestones, especially my babies, is just really special to me. I still talk to some of my families today, so it's just been really cool to see the patients grow up over time, because I started working there after I graduated. So it's neat to see them grow into like little adults and thrive in their life. Yeah.
Fantastic. And then Dawn, I think you have some funny stories from the burn units, right? Working with patients.
Yeah, yes, a very monumental event. We had a patient that was pretty freshly post-op after a skin graft and had some mental health challenges and escaped the unit and literally made it to the L stop, which is many blocks away, running, and security had to chase them. So that was an interesting event. I think.
Did he have a gown on? Did he have his gown?
I am not sure that. Yes, started on, but did not stay on.
Oh, wow.
Pediatric patients are easier to catch, I think, sometimes.
I am not sure how that patient was not so uncomfortable, but they tried. So, yeah.
Yeah, independent with mobility. His gait speed is pretty good, right? His 5-time sit stand is probably high up there. He's got all.
Yeah, I was like, you are doing great. Yes.
Right.
You are definitely.
From a mobility standpoint, right?
Independent with your mobility. Yes.
Fantastic. Yes. I want to circle back to the Pediatrics Vital Signs Guide. Can you talk a little bit about kind of the work that was put into putting this together? And the other thing I do want to mention is, I think that's great, Ashley, that you came to Tracy Norris, who is our current president, and said, we need one for pediatrics. And she was super supportive and said, okay, let's make this happen. What do we need to do to kind of help facilitate that? And Ashley, we were able to kind of get the ball rolling. And although, again, there were the challenges, but I think what's good is we already had the template of the original adult vital signs guide. So can you, maybe the both of you, just talk about the work that was put in to kind of coordinate? Because we've got 3 sections altogether that we had to collaborate with, right? Acute care, cardiopulmonary, and pediatrics.
Yeah. So I'll kind of talk about when we started out. We did a call through all 3 academies. So we really wanted representation from all 3 because we do look at things in a different lens. I would say pediatric therapists focus a lot on development, whereas cardiopulmonary therapists are more about hemodynamics versus the development aspect of it. And then acute care thinks about all of the lines, tubes, drains, medication, and that angle. So we had representation from all 3 academies. We did have the template of the adult guide, which was just a lifesaver because we could go through and mimic the same kind of document that was put together. I will say we struggled a lot because there are not a ton of resources out there in terms of peds vital signs or lab values, and all the references we found differed in values. So it was hard to put a lot of this together. And then we had to tailor it to the pediatric aspect and not make it too much like the adult vital sign guide. And what we came up with originally, and Dawn will probably laugh, it's a massive document. It was a textbook. And we were like, we got to shave this down and make it like a guide people can actually use in clinic practice. So Dawn and a couple other individuals came in to kind of help on that aspect and cut things down. So Dawn, I don't know if you want to talk about from that point how we narrowed this down.
I will say it was challenging. The document was so fantastic, but it was just so large. And I will say it took us a while to really get it to where it landed. It took a while to kind of shave out what we felt was really the most critical information. We had other diagnoses in there, and what you could make this a textbook. It would be really hard not to. And I think having all the experts from the beginning and then the ones that were joining in later, we were able to really narrow our focuses down on what we landed on. So I think it was so great to actually see it from the beginning, because that way we knew we're like, this is such good information. But again, we really got to kind of narrow our focus down. And I just think it's great. And when you think about it, you're like, how do we not have this resource? And it's really challenging because, like Ashley said, you will find variants of the information out in the literature and in textbooks that might be outdated or current. And it was probably one of the hardest things to actually cut information, because you're like, this is still really valuable information, but we really want to focus on getting this information so it's a usable document. And I think hopefully we were able to achieve that. Yeah.
I've sat on a couple of different projects where, again, we're trying to create some type of guide for the users, basically our constituents, members of APTA Acute Care and acute care physical therapists, regardless of the setting, whether you're in the hospital or even in outpatient, working with the patients that have a sequelae of acute care problems, or even home health. So I think the user interface is so important. Can you maybe talk a little bit about how you foresee physical therapists that are working with pediatrics that have acute issues, how they can best utilize this document?
Dawn, do you want to go first?
Sure, I can jump in. That'd be great. So I think what I would recommend is probably, depending on your area, it might be nice to actually, I'm going to back up a little bit. When you actually first look at the document, it's a great overview of just the lifespan within a pediatric lens. And so honing in on those first few areas of content, but just gives you kind of basics, heart rate through the lifespan, your respiratory rate. So that way you're familiarizing yourself, generalized levels to look at. And then if you are in a specific area, like my area of expertise is really within the NICU, we have that very nicely outlined. So that way you can focus in on that. And within that, I think looking at what areas you are specific to, then it's really mapped out for you. But I think that beginning section is really important to highlight. So that way you're like getting your foundational guidance that way.
That's great.
Yeah, I agree with Dawn, and we designed it so it could be a little bit of a standalone document, but also it could be used as an adjunct with the adult guide, because we have therapists who are working in acute care hospitals and they're seeing both peds and adults. So together, this guide can just be there if you need a reference quickly in acute care. But also other, as you mentioned, Leo, like other therapists can use this because it's really important to know where these kids came from. Mm-hmm. We're seeing specifically a lot of kiddos with congenital heart defects that are growing up and surviving into adulthood. And there's a huge gap there between being treated as a pediatric patient versus an adult patient. So I think it's really important to know where those kids came from. And then also from a pediatric perspective, kind of thinking about where they're going to go after they leave you. So I think this document's really for all therapists in a way.
I just chime in, such a valid point, because I know, and I don't actually work in our CICU, our cardiac unit, but we definitely have adult patients because of their congenital defects. And so they're best treated back with the physicians that might have treated them as infants and children. And so your comment about this document really being for everyone is very valid and makes a lot of sense. Yeah.
Yeah.
Have you gotten any feedback yet from people that have used it? Or what I think is great too is that for some of the other projects or the other kind of guides that APTA Acute Care has put out, a lot of either residencies or different PT programs utilize these documents from an academic standpoint, and they'll reference them. So the work that you all have done is, again, it's being utilized. I'm just wondering if you've gotten any feedback, if people are using it pretty consistently, or they've said, oh, wow, yeah, this came in really handy.
Yeah, that's a good question. I know we released it through all 3 Academy channels, and we had a lot of downloads just in the first day, but I haven't heard any specifics about how people are utilizing it. And I don't know if Dawn, if you've...
Yeah, I would say that the same sentiment. I haven't heard a lot. I know I kind of highlighted it at work, particularly for the students that we have coming in. I'm like, hey, this is something so I got a lot of great feedback from my colleagues that they were excited to use it, but specifics I have not. So I'm hoping that with this dissemination through the podcast and other avenues, we'll hear some more feedback. And we definitely did talk about how this document, we wanted it to try not to have to do major revisions through the years, that it would be information that could, kind of last, with the recognition that, of course, things will change. We might have to do there might still need to be some revisions, but overall it should stand pretty well through the years.
Fantastic. I know through APTA Acute Care, you can access it via our learning management system. So for those listeners out there, if you want to get a copy of the Pediatric Vital Signs Guide, it came out, I think, was it just at the beginning of the year, January 2026? Is that when it was released? So through our learning management system, you can access it through APTA Acute Care. But Ashley, you said it's also available in some of the other
and you can and you can download it through our CardioPulm website, and it's available for free for members.
Fantastic. Very cool. Any other advice or anything else you'd like to share for our listeners? Especially, we have a lot of students that listen to the podcast. So if you have any advice for any students, possibly like, for example, my students at UIC are going to be going. I just had a batch that graduated, so congrats to class of 2026. But class of 2027 is going to be going out into clinicals. And what I've noticed, at least in my program, is that there's a lot of students that have interest in A, pediatrics, and B, pediatrics on the acute care side of things. So do you have any words of advice for either A, those students that are going into a peds rotation, or those students that are maybe kind of on the cuff about pediatrics, they're still kind of deciding as they're choosing some future placements?
I'm happy to start. I think just keep an open mind if you're a little on the fence, because you might surprise yourself that you actually enjoy something more than you initially thought. And I can obviously speak through that with experience. And I think with just heading into an acute care environment, it's, I guess, important to really remember that your clinical reasoning is so important, but you're not going to know everything. So ask questions and be honest with yourself and be honest with your CI. If you don't know something, it's totally fine. We would rather, I think, as a clinician with students, I would much rather have a student let me know that, or let me know the questions that they have, versus just going in, I think, full throttle and not maybe just being so uncomfortable that they didn't want to say anything. So
that's such a good point. There's so many students that they're fearful of being judged, because maybe they're like, I do remember having my peds class X amount of semesters ago, and I don't have them completely memorized. I don't have all the months and dates of all the milestones memorized. But I think there's a lot of clinicians. That's why we've got access to resources to be able to pull that out. And I think it's better that let's talk about that and let me know where your thought process is, so that we can kind of meet in the middle and help facilitate some of that learning.
Absolutely. Yeah. I ask questions every day.
The CIs and clinicians that I have lots of experience, we still have to be able to ask questions. And if we don't know it, let me figure out who I need to ask to try to get the correct information. Yeah. Ashley, did you have any advice for any students out there?
Yeah, I was going to say
new grads.
I was going to say exactly what Dawn said. So I'll kind of pivot and say reflect often. And this is something I had to learn to do fairly early in the clinical process. I would go home and say, what went well today? What did not go well? How am I going to improve for tomorrow? But also focusing on the positive in that and what you did well. Because a lot of times as students or new grads, we just focus on things that did not go well. So it is important to reward yourself for things that did go well. I'll say on the other half of that, if you specifically want to go into acute care peds, sometimes it's difficult to find a job because there aren't as many pediatric hospitals as there are adult hospitals. So just hang in there if it's really hard for you to get on at first. Get experience in acute care. That always looks really good if you go from a whole hospital to a pediatric hospital. But those jobs do open up. So just be patient if you can't find one right out of school, because no one likes to leave pediatric acute care. It's the best setting.
I agree.
So the turnover is not that high, right?
That is very useful information, because I do get people seeking, how do I get in, or what's the best way? And honestly, I remember going for my interview and I'm like, I've mostly been working with adults. And so I was like, oh, I'm never going to get this job. But I think your point about getting just acute care experience is super. It's 100% helpful.
Awesome. Very cool. It's time. We're at about that time now. We're going to move into our rapid response. But before we move into rapid responses, Ashley, do you have any, first of all, how can people find you? If people had questions for you, for part of you helping out with APTA Acute Care, but also being the CardioPulm Madam President, how can people connect with you or find you?
You can find me everywhere. Just Google. You can email me. My email address is on LinkedIn, our UAB website. You can find me on social media and Instagram, Ashley Parish _PT. I'm a huge LinkedIn user, so you can easily find me on there. I'm addicted to LinkedIn for some reason. I don't know why. I don't know if it's the little dings when people add you or what, but I love LinkedIn.
Awesome. But if I Google your name, I think sometimes will that post from Reggie Miller, is that going to come up? Is that what you most
I wish.
Reggie, can you tell us a little bit about that? What happened out? What's your connection with Reggie Miller? Because as a Chicago boy and a Bulls fan, Reggie Miller versus Michael Jordan was such a fantastic rivalry, but
I didn't think about that. So my deal with Reggie Miller, when I was little, my parents loved the NBA, so I grew up watching it, and we lived in San Antonio at the time.
Ooh.
My parents are diehard Spurs fans. I was like, I don't want to be the same team as my parents. And I saw Reggie Miller play, and he hit so many 3-pointers that game. I was like, this is my man. I love him. So I've been a diehard Indiana Pacers fan since I was little. And I got to go to game 6 this year, and that's where I cut off my memory of the NBA final, or last year. I cut off my memory of the NBA finals because we don't talk about game 7. I just can't go through that again. With Tyrese getting hurt, that was just traumatic for me. But I got to go to game 6 in Indiana, and I went to the painted building with Reggie Miller and took a picture. And Reggie Miller reposted my Instagram post. It was the highlight of my life. I literally emailed it or texted it to everyone I knew in my phone. And I was like, Reggie Miller reposted my Instagram post. So that is my fun fact for life. Whenever I have an icebreaker activity and they're like, what's your fun fact? I'm like, Reggie Miller.
That's awesome.
That's very cool.
If anybody knows the acute care therapist that worked with Tyrese Halliburton for his crutch training, I'd love to have them on the podcast, or at least connect them to Ashley, who taught him how to be mobilized with crutches. That's a great story, Ashley.
He's coming back. He started playing contact.
That's good.
Yeah, fingers crossed.
Dawn, how can people contact you if they have questions for you?
Yeah, so I am on our website for, if you look up Anna and Robert H. Lurie Children's Hospital, I'm on the website there through Rehab Services. I'm also on LinkedIn, and actually my husband is a huge LinkedIn fan, and he's like, you need to get on that more. And I was like, I don't remember my login most of the time. So I'm going to be better, but I am on LinkedIn as well.
Fantastic. Awesome. All right. So I'm going to set the timer up. We're going to get to our rapid responses over here. And since there's the two of you, we need to go for about a minute and a half. Let me set up the timer over here.
I'm not looking forward to this.
Just the first thing that comes up to your head, just go ahead and but it's got to be rapid though. So the first thing right away. Y'all ready?
Sure.
All right. Let's get started. All right. Ashley, describe your most favorite type of pizza.
Oh.
Margarita. Fantastic. Dawn?
I'm going with margarita as well.
Margarita. Excellent. Ashley, your favorite way to exercise?
I like to take walks just to clear my mind during the day at work.
Fantastic. Dawn?
I love to lift weights.
Fantastic. There we go. As a physical therapist, that's awesome to hear. Ashley, your favorite color scrubs to wear while you're at work?
Oh, since I'm a peds therapist, it's always fun, bright colors. I would say Barney purple is my favorite set.
Barney purple.
Oh my gosh.
I know that color. Just thinking about it when you say that, it's a perfect way to describe it. Done?
Oh my! So sadly, we don't actually have to wear scrubs at work.
Wow.
And we don't have a color, but I feel like physical therapy was always blue. We always were like blue at county.
Some type of blue.
Going with my basic blue.
Awesome. Actually, when you're working on acute care, what type of shoes are you wearing?
Oh, Brooks.
Brooks. You get discount. That's right.
Yeah, you do, but they're my favorite tennis shoe to wear. They're just the perfect balance of flexibility and stability.
Fantastic. And Dawn?
Oh my gosh, I have Brooks as well. Brooks Ghost. That is
Brooks Ghost.
I used to be a big Hoka fan, but have now gone to the other side.
Awesome. Ashley, name a therapist. Give a shout out to a therapist that's been influential to your career.
Oh, there's so many. Dan Malone.
You can name a couple. Go ahead.
Larry Cahalan, Ellen Hilligas. There are so many out there. You mentioned Donna Fraunfelter earlier. A million. Just all of my seasoned therapists that came before me.
Awesome. And Dawn?
Oh my God. The queen at Lurie was Mary Weck. People might not recognize her name, but if you look up at Pathways, she was on some of those videos, and some other colleagues of mine. Lynn Boswell, she does a lot of early detection with our infants out of the NICU. And I was going to mention Claudia Kelplanade. She's another, with her and Julie Perfect, they're doing a lot of early standing with infants in the NICU, out of the NICU.
Fantastic. You mentioned Pathways from University of Illinois at Chicago, Gay Girolami, Dr. Girolami, right? That all work with Pathways. So shout out to Gay.
Love her. Yes. She's
awesome.
Amazing.
And then final question, Ashley, you know you're an acute care win.
You have a disdain for pure wigs.
Yes.
We do not
It's
like
our enemy.
them. Yeah.
And Dawn?
You have changed more diapers than you would probably like. Getting
In both adult and pediatrics, right?
Yes.
Poop. You can't get away without poop talk.
No.
You can. That's part of our routine here on the acute care side of things. But Ashley, thank you so much for being here. You too, Dawn. Thank you so much for being here, part of the podcast. And thank you for sharing your insights on the Pediatric Vital Signs guide.
Yeah, thank you for having us.
Yeah, thank you so much, Leo. This was great.
We would like to thank Ashley and Dawn for joining us on the podcast. Acute Conversations is the official podcast of APTA Acute Care. This episode was hosted by Leo Arguelles, executive produced by Katie Brito and Edward Mathis, music by Alexia Action from Pixabay, sound effects also from Pixabay. For more information about APTA Acute Care, be sure to check out our show notes for links and resources from the Academy. If you found value from our podcast, please be sure to subscribe, follow, and share with your friends and colleagues. Join us next time for another engaging acute care conversation. Thank you for listening, and may your shoes and scrubs stay clean today.